Today, we're diving into the fascinating yet challenging world of equine health, focusing on a condition that can cause quite a scare for horse owners: acquired inguinal hernia, or AH. Imagine a majestic stallion, perhaps just after a spirited exercise session or a breeding event, suddenly showing signs of intense abdominal discomfort. This is often how AH presents itself, as a common cause of colic, especially in stallions, where a loop of small intestine protrudes through an opening in the inguinal canal. It's typically a one-sided issue. Our featured study reviewed medical records from 2005 to 2020, offering a broad look at 98 such cases in 97 horses.
That's right. When a horse like Spirit arrives at the veterinary hospital with these symptoms, time is of the essence. The study found that 65% of these cases required emergency surgery to reduce the hernia. It was a significant concern, representing 1.6% of all colic cases admitted to the hospitals and a quarter of all stallions undergoing emergency colic surgery. A worrying finding was the high rate of concurrent small intestinal volvulus, meaning the intestine had twisted, which was identified in 27% of cases. This twisting dramatically complicates the situation, often leading to more severe outcomes.
And that brings us to the critical factors influencing a horse's chances of survival. The study highlighted some key challenges. Draft breeds, for example, had a significantly reduced chance of survival, with only 7% making it to hospital discharge. This might be because their stoic nature often leads to a delay in seeking veterinary care, with these patients presenting much later after the onset of colic signs. Another major red flag was a high heart rate upon admission, which was strongly associated with a lower survival rate. This reflects the severity of the horse's physiological distress and cardiovascular compromise. Lastly, the presence of concurrent small intestinal volvulus was a clear indicator of reduced survival, tripling the risk of non-survival compared to cases without it.
Absolutely. Understanding these prognostic factors is vital for veterinarians and owners alike. While surgical intervention is often necessary, manual reduction was successfully attempted in 66% of cases, sometimes avoiding surgery altogether. Castration was the most common technique to prevent recurrence. The overall short-term survival to hospital discharge was 60%. However, for those horses that made it through the initial critical period and were discharged, the long-term prognosis was remarkably good, with 94% still alive after 12 months, and most returning to their previous athletic performance levels. It's a powerful reminder that while the initial battle is tough, the commitment to care can lead to a full and vibrant life for these animals.